All right, welcome to phase one, or the acute phase of neck pain that you might be dealing with. Now, at this point in time, I would expect you're not doing too well. There could be a lot of localized neck pain. You could be having a really hard time keeping your head up. You might have pain down your arm. Generally speaking, the most important thing we need to work on in this first stage is controlling your symptoms and trying to get a normal posture. Your body's always going to try to put you into a position of poor posture when you're in pain. So we're hoping that we can get you out of that even with some simple adjustments. Now, Teresa right here is showing us someone who really is having awful posture right here. And this is what we often see in our clinic. Someone will come in very hunched over, and that may be the way they've always been. And you've heard people harp about posture, 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 but there's no way around it. Posture's got to be good. If you don't have good posture, you're going to end up back in the physician's office. So it's really pretty simple how we line up posture. With Teresa, I'm going to bring her up to where her chest is out and her shoulders are back and down. Okay? A lot of people, because of the stresses we have in life, our shoulders are always up, shrugged, and our head is forward. But I want her shoulders back and down. You may feel like you're sticking your chest way out, but you're really not. You're just trying to program your body to be what normal is, and it's not used to being normal, so this doesn't feel normal. Secondarily, we want to make sure that if we see this seam that we happen to have here in the wall as a plumb line, we would love to see that plumb line drop through about 4 points of contact: the ear, the shoulder, the hip bone, and the ankle bone, as a very long line that should be straight on. So sometimes that will require a little extra work. And if you're someone who is great with getting their shoulders back, chances are your head is forward. This is where disc problems and a lot of neck pathologies start. So the first exercise, besides postural alignment, which is shoulders back and down, is the chin tuck. And what we want to do is bring your chin in. Yes, create a few chins here to actually keep yourself in that good alignment. Hold it for about 3 to 5 seconds and then relax. Do not relax, but instead take tension off. Now, if you're having pain in your neck or arm pain, it is very likely that when you go back there, those symptoms will increase. That doesn't worry me. We need those symptoms to increase because what you're doing is forcing a disc or a neck joint to actually go into a position that it doesn't want to go into, and it needs to go there. So you're going to work through this and work yourself like crazy to maintain that posture. The chin tuck is one of the single most effective things you can do to get that alignment back. If you are getting a lot of arm pain with this, and it doesn't get easier the more you progress, you need to back off on this and recheck in with your doctor. But with time, that should get easier. So for now, if you're working on shoulders back and down and chin tucks, you are really going a long ways toward getting the first stage of your back corrected.